I'm Brian Rasnick. I'm the president of 90 Degree Benefits Florida office. And we've got David Jacobson as well, who's the vice president of sales for 90 Degree Benefits in our Houston and Texas offices. So those are the two of us that are going to be presenting today. We picked an interesting theme and topic for the month of October, which is obviously strange plan design. So monthly family deductibles and other strange plans. And I think you guys will really appreciate a quick 30 minutes, and hopefully you'll have a bunch of questions to ask at the end for us to answer, as well as maybe help you get some quotes for some groups of yours. Let me see if there's anybody else in the waiting room. There is not. All right, who is 90 Degree Benefits? 90 Degree Benefits, for those of you who are on our Wednesday webinars for the first time, 90 Degree Benefits is a conglomerate of TPAs that have been purchased throughout the country. Most of the TPAs were independently owned, and Blue Cross Blue Shield of Alabama has purchased most of our TPAs starting back as early, I think, as 2015 or 16. They purchased 13 offices or 13 companies, which we now have 24 offices. We're serving roughly 525,000 members nationwide, and our average office has been in business for 40 years plus. You can see where our offices are. We are licensed in all 50 states and have the ability to write business with reinsurance, self-funded traditionally or level funded, with no problems in all 50 states. Other than that, we have access right now to multiple networks. Our preferred network right now, or most offices, we lead with Cigna, but we have the ability to write on Cigna's network, United's network, Aetna's network, First Health, Anthem. We're getting access to the Anthem network starting January 1st. So if you're interested in writing business with any of those networks, obviously you can ask your local 90 Degree office for a quote that will include those networks. So the topic today that we're going to touch on is an interesting one. It's one that David and I have learned. We created this product and this plan design probably back in the, what would be, early 2000s, David, or were you guys in Houston doing this well before that?
Oh, we've been doing it since the 70s. I started doing it in the 90s. So
okay,
I think you guys did too, Brian.
Yeah, I think we may have done it in the late 90s. So basically, the question that's asked always of us is, why are chronically ill people treated better than healthy people? And it seems to be a problem with today's traditional insurance plans. And most insurance companies, they won't agree with this just because they can't figure out how to do monthly family deductibles. And excuse me, we should have had somebody else approve people to come in, David. I don't know how, I don't think you can let them in. I have to access them in. But so we go back to traditional plan designs. Traditional plan designs for the chronically ill are pretty fair, but for the young studs like David Jacobson, who you'll see his picture pop up shortly, those people get hurt in a traditional insurance world. And let me explain it a little bit more. Let me go into it. So traditional insurance plans today, the way that actually I always tell David and I talk all the time, our fathers were in this business, we think 100 years ago. So when they created insurance 100 years ago, they created traditional insurance plans with annual deductibles, co-insurance. There was no such thing as copays way back when, but copays obviously came about in the late 80s and early 90s when HMOs came in. Annual out-of-pocket maximums, and then once you've reached your deductible and you're out of pocket for the year, everything's covered at 100% for the remainder of the year. And so why is that unfair, or why is that fair? So to a person with a chronic condition or a chronic disease, they have a budgetable amount. Now, it may not be an amount that they can afford, but at least it's budgetable. So depending on their deductible, if it's a $500 deductible or a $5,000 deductible, they know that on January 1, their deductible and out-of-pocket is going to reset. And usually January, February, March go by, maybe April, They're having their typical expenses with deductible and coinsurance and copays. And by the time April comes by, most chronically ill people have satisfied their deductible and they're out of pocket for the remainder of the year. So they have 100% coverage. You go into a healthy person like David Jacobson. So scenario one is what I just talked about, able to plan and budget expenses monthly, usually 3 to 4 months, sometimes 5 months. They have a budgetable amount and it's the same amount or maybe not, but they'll have satisfied it by the end of the 3 or 4 months. Scenario two, accept somebody. Scenario two is the healthy 22-year-old basketball injury. So you've got an employee that goes 11 months out of the plan year without having a single claim. So they're healthy. They're living life and they have insurance because they know it's important. But all of a sudden they play a basketball game, a pickup game on December 2nd, and they blow out their knee. In today's world, in today's plan designs, Bubba has to pay his entire deductible and out of pocket in the month of December because that's when that claim happened. He hadn't had any expenses before that, and he was unable to budget that dollar amount. So in the month of December, if he has a $7,500 out of pocket maximum, he'll have spent his $7,500 in 1 month. Whereas the cancer patient obviously goes month to month, budgetable, divided out, and it's 100% for the rest of the year. So David Jacobson, actually David and his dad Ed, what he just said in the late 70s, early 80s, created a monthly deductible plan design. And we say monthly deductible or monthly family deductible. It's either way. Some of our plans go just monthly. Some of them are family and include the family amount in that dollar amount. So we break down deductibles into monthly. So let's just say, for example, we sell a plan that's a $500 monthly deductible plan with a 10 times out of pocket max. So it's obviously $500 a month, 10 times $5,000. And once somebody hits their deductible in a given month, everything's covered at 100% for the rest of the year. So let's see how that would affect scenario one. Scenario one, actually, we'll go back. Scenario one is that chronically ill patient. $500 monthly deductible plan. In January, they're responsible for $500. And for the rest of the month, once they've spent that $500, everything's covered at 100%. If the next month they have another $500 in claims or 500 plus, they're responsible for their $500 monthly deductible, and everything for the remainder of that month is covered at 100%. So as you can see, those monthly deductibles reset every month after they've spent their money. Worst case scenario, that chronic patient, that one that was going to have a $5,000 out of pocket previously in the traditional plan, they're still going to have their $5,000 that they're going to spend at the end of the year in total, but they'll be able to have it as more of a budgetable expense, and it'll be $500 a month times 10 months. Go to scenario two. The young 22-year-old that has the basketball injury. 11 months without any claims, no copays, no deductibles, no coinsurance. That employee is super happy, and they blow out their knee and have their knee surgery. In the monthly family deductible plan design, what does that person pay? That person pays $500 for those expenses in that month, and everything else is covered at 100% for the remainder of that month. Okay? So we've just treated a chronically ill patient better than what they're being treated now because they don't have to spend that $5,000 in maybe month 1, 2, or 3. They can divide it out over basically 10 months of time. The healthy person that's 22 years old, they're going to have their out-of-pocket for the year is $500 because they made it 11 months. And as you can see over on the right-hand side, monthly deductible is not aggregating. So once you make it past a month without spending those dollars, you've just made it past that month without paying any deductible. Some of our monthly deductible plans include office visits and prescription copays. Some of them do, most of them do not, but that is up to you as the agent or the customer on how you want to handle that. Some people like to bring in the monthly family deductible plan design, not include copays other than prescription drugs, and then they have their prescription drugs obviously track towards the monthly deductible as well. The annual out-of-pocket max still applies. It can be 12 times, it can be 10 times, it can be 5 times. It's up to you as the agent or the customer on what your out-of-pocket is going to be. I always recommend 10 times, and the reason for that is we don't want to have a chronically ill person have monthly deductibles 12 months out of the year. It's an HR issue. It makes them feel better when we can go into the chronically ill and say, hey, listen, we know you have expenses. We know you're going to hit your $5,000 max, but we want to give you the months of November and December off from paying a monthly deductible plan because it's the holidays, and we want you to have some extra money in those 2 months. But again, it can be any way we want. We could have $100 monthly deductibles. In fact, David, when we sold our first family monthly deductible plan back in the late 90s, we had a plan that was still on a $50 monthly deductible plan design. Now, today, we're seeing family monthly deductibles anywhere from $500 to, we have a plan that's $1,600 a month, but they only have a 5 times max for their out-of-pocket max. So you can get as wild and crazy as you want on these things, but it levels the playing field. It makes a person that is chronically ill still feel good that they're not having to pay $5,000 in month one. And on the flip side, the healthy person as well is rewarded for being healthy. The only catch to it that I talk about is what happens when we have a lady going for a delivery of a baby, and she goes in on January 31st, and she actually delivers the baby on February 1st. How many months has that patient been in the hospital? And the answer is obviously 2. There's 2 months. So she would have 2 family monthly deductibles for that particular claim. Again, still much lower than what she would have had if she was in a traditional plan design. And you can see here, we gave some examples. Procedures with any, so normal delivery with a sick baby, procedure cost is $25,000. A $500 family monthly deductible plan out of pocket is $500. Again, if it's in that same month. If it was over 2 months, it would have been $1,000. On a traditional $2,000 calendar year deductible plan, member out of pocket's typically $4,000. That baby would have cost that family $4,000 on that $25,000 versus a $500 claim. Another one, food poisoning, family of 3, $500 family monthly deductible plan because it's $500 for the full family. So it's 1 person sick or 3 people or 5 people sick. It's still $500 for that entire family. Typical, in a typical plan design, you could see a $6,000 out of pocket for that family from food poisoning. Again, we've gone through the knee surgery one in my example. $500 in the month of December when that patient goes the first 11 months without having any claims. It's a $500 out of pocket versus maybe a $2,000 or $3,000 or $4,000 out of pocket if they had a traditional insurance plan.
Brian, there's a question. I'm answering it in the chat, but it says, what is the difference on these types of plans versus traditional plan designs? Also, can the ER attach an HRA, the employer attach an HRA to cover a portion of the monthly deductible? So my comment from the rating equivalency, if there's co-pays in a plan design with a monthly deductible, it's usually 2 to 1. Right, so a $500 monthly deductible, rate out like $1,000 calendar year deductible when it's a or 2.5, and on a plan that doesn't have co-pays, it's usually 3 to 4 or 4 to 1.
Yes, so that's good questions, and HRAs still are applicable. You can still have an HRA plan design. The area that gets a little sticky with monthly deductible plans would be HSAs because you can't have any first dollar coverage, obviously, so that limits us from having any copays. Technically, a monthly deductible plan design still is a deductible. So that's where that HSA gray area comes into play is, hey, the employee has satisfied their deductible for that given month. So an HSA still would apply once they pay their deductible in that month. Again, why don't you see this in a lot of different entities or a lot of different TPAs or insurance companies? We were all programmed in our lives to have our claim systems reset deductibles and coinsurance annually. So it didn't matter if it was plan year or calendar year, it was an annual reset in our claim system. We had to program our claim system to reset deductibles each month and not aggregate them. And that's a tough thing. And so from the standpoint of how many TPAs can do it in the country? There's probably only a handful of TPAs that have ever been able to do this in the country. And I don't know of a single insurance company that has been able to do this. But as an agent out there, we present this all the time to agents in Florida and in Illinois. And they love it because this differentiates. This is no longer coming in with just a typical, hey, here's your deductible, here's your co-insurance, and here's your rate. Now it's let's make this better for everybody, healthy and sick. So DJ, I think there was another question. Did you want to? Was there, or was that one that just popped up?
There's one that says more specifically, I was interested in monthly premium difference between weekly deductible versus a plan with a $5,000 deductible.
So I will give an example of a Florida customer that just renewed with us on July 1st. They had a $2,000 deductible plan with a $7,500 or $7,000 out-of-pocket maximum. So it was $2,000 with $7,000 out of pocket. They had an employee that was going to have a baby next year, and she couldn't afford the $7,000. So she ended up leaving the employer because she wanted to go to a richer plan design with another company. She just couldn't afford $7,000. She was family planning and made the decision to leave their employment. So when we did the renewal, we went to the underwriter and asked about a $700 family monthly deductible plan design with a 10 times max. So that matched their $7,000 that they had out of pocket, right? So the max out of pocket was the same. And the reinsurer, the underwriter, said, we will give you the exact same rate. So it was a 1.5% rate increase on the renewal for this group with the 2,000, 7,000. And we put in the family monthly deductible plan of $700 a month, $7,000 out of pocket max. And it still included all the copays that they currently had. So they didn't get rid of any of their drug copays or office visit copays or even urgent care ER. It didn't, they didn't eliminate those, and the underwriter gave us the exact same rate. So he said for the 1.5% increase on renewal, pick the $2,000 deductible plan or the $700 monthly deductible. Now, this employer did say to me while we presented this, I can guarantee you, Brian, if we had this plan design in place before she quit, it would have been a no-brainer, because I could have told her next year when you have that baby, you're most likely going to spend $700 if it's in 1 month or $1,400 if it was in 2 months. And his comment to me was, shame on us for not being creative earlier in our relationship with them, and shame on me. I've had that plan design in my back pocket for years and years and years. The higher the out-of-pockets are getting these days, the more monthly deductibles make sense. David, any other questions there?
I think we're good.
Okay, so from the standpoint, so if it in a summary to answer that question, to make sure that everything's even, chances are we're going to have the same rate as we would have on a traditional plan design. The difference being is it's much more affordable and a much friendlier plan to sick people and healthy people. Again, and to save a little time, I know, David, you're going to be talking here soon. Advantages are it lowers patient financial responsibility, lowers claim costs to the plan. It's richer benefits. I don't know of anybody that I've presented this to in the past 6 months that has thought that it wasn't a richer benefit plan, and it's the same rate. It reduces excess claims utilization by keeping members financially engaged. We all know that what HSAs did and HRAs did for us in the last 20 years, it made people better consumers of healthcare. When they know that they have a $500 monthly deductible plan, they're starting to plan things. They start reading the menu from right to left, asking prices. And so it reduces excess claims utilization for that. Obviously protects workers' budgets with lower financial stress. It's employee retention. Okay. If you have a plan right now that has a $7,000 out-of-pocket max, those employees are worried about having a large claim that they'll have to spend $7,000 in 1 month. So family monthly deductible plans really do well. It says proven track record, 3-to-1 factor. I would argue, David, if there were no copays on there, I've seen underwriters give us a 5-to-1. So if it was currently a $2,000 or a $2,000 deductible plan, we can write a plan, a monthly plan, family deductible plan of $600-700 a month, and it's going to be a savings.
Okay,
All right.
so Brian, just so everybody knows, Brian, for this Halloween presentation, was willing to dress up as Mr. Clean.
Yep.
And
That's my
basically,
point.
we did that because he likes to clean up current plans with monthly deductibles, things like that. But when you want to come up with creative designs, you need more of a superhero, right? So my goal is to come up with good old-fashioned American solutions for creative issues. I do want to address the people that had asked the question about calendar year deductibles with HSAs, monthly deductibles with HSAs or newborn situation, because that's in the chat. What we've done to turn a monthly deductible into a HSA qualified plan is we'll often do the minimum annual deductible on the front end, and then once the minimum annual deductible has been met, we'll put a monthly deductible in or a monthly copay for those expenses beyond that, which makes it more budgetable and that allows you to actually save money than selling a $3,000 or $4,000 calendar year deductible. So again, you can use that concept in a lot of different ways, and if you do it as a family, then the entire family's expenses will apply to that. But one of the things that we're seeing a lot of is coming up with solutions for minimum essential coverage plans, and a lot of people think a MEC plan is preventive care. So what I'm going to do, Brian, if you'll go to the next slide, and this will go real quick, everybody. So the criteria for creating a MEC alternative, what we want to know from the broker or the employer is, hey, what are your plan design goals and objectives? What is your budget, and what are you trying to target as contributions? What employment classification are you trying to do? Is your intent to offer a major medical to your salaried population because you're a restaurant group and you want something affordable MEC wise but still provides a benefit for the hourly? There's all sorts of different solutions, right? And it really depends on what availability for marketplace alternatives. So if your individual population has access to major medical, whatever it may be, you may decide, hey, I can afford a MEC plan, provide some routine care, and they can get catastrophic in the market or somewhere else. And then, of course, you're going to look at the health risk of the population, because most people that are doing a MEC plan are saying, I can't afford major medical. So when we look at MEC plans and the 90-degree benefits consultants, sales staff are trying to work with the brokers or employers, we're looking at the components and saying, okay, these are the plan design components. So it's preventive care, office visits, labs, x-rays, office surgery, imaging, testing. That is the component. Those are the components of an entire plan. So if you go to the next slide, Brian, what you'll see, and again, I'm doing this quick because of time, what you'll see is we will identify the component of a plan. So if you think about minimum essential coverage versus minimum value, you're basically saying, how do I fill the bottle of water up to that 60% line? And if I'm under it, it's technically just a minimum essential coverage plan because it's got preventive care in it. And if it's over that, it's a minimum value plan with MEC in it. So here are some common minimum essential coverage plans, price points that employers have asked us to design. Right now, there's a heavy push since COVID for virtual care. So we will put in preventive care with virtual access to either primary care physicians, behavioral health specialists, things like that. Oftentimes, it'll include lab and basic testing, so lab and x-rays. That way, if you're talking to the primary care physician in a virtual environment, and we're not talking telemedicine, they can still refer you to your closest LabCorp request, clinical pathology lab, or an x-ray and identify 90% of what's going on with you. Oftentimes, these plans will put a discount RX, will put advocacy in place for the items that are not covered, and an EAP to cover that light behavioral health. So if you think about it, and again, EAPs are often virtual. So if you look at that virtual program, what we're trying to do here is come up with a product that's $100 or less, but offers some good routine care, and provides a solution for lower cost and lower cost contributions. The next step up, we'll often do a doc MEC, right? And I think a lot of you have seen that before, and sometimes you'll stack supplemental products on top of it where you actually have copays for physicians, specialists, things like that. You may cover imaging, some generic drugs, or a limited brand formula, things like that. What's actually interesting for employers that are saying, I want something that looks more like major medical, but I can't afford full-blown major medical, or my participation is bad, So I don't have enough of a pooling risk for a stop loss carrier to be willing to underwrite our product. So what we'll do is we will do a hospital mech is an amazing program. If you think about car insurance where you're just covering the catastrophic care, we've actually designed plans. These are priced out at $200, $250, where the company says, hey, I'm going to do a $500 monthly deductible with 100% benefit. But the plan is going to cover preventive care, emergency situations, outpatient and inpatient. So it'll cover the birth of the baby, but it won't cover the prenatal and postnatal care. A lot of times employers will stack that with the FSA or some sort of HRA reimbursement to provide for upfront benefits, but it's like car insurance. Hey, we're not going to pay for your gas. We're not going to pay for minor repairs, but if something catastrophic happens, we will cover that. The nice part about this program is when the employer says, I'll pay for this hospital mech for everybody, you now have a pooled risk from the large dollar claim expense, and you could design any number of buy-ups to allow the employees to buy up, because that's almost like buying up for prepaid care. So the hospital mech is an amazing plan. A lot of people don't understand it very well because everybody says, well, what are you doing on imaging and testing? Hey, it's not covered. That needs to be covered a different way, but we will cover if they go in the hospital. And then the complete care mech, that's really plans that are not 60% value, but look like a major medical. But we may exclude things like specialty drugs, transplants, chemotherapy, radiation. We may limit inpatient days to 10 days per plan year, or outpatient procedures to 5, to 3 in a year. So it's not indemnity. It covers it like major medical, but it just doesn't hit that 60% value. So these are some interesting mechs. We're a couple of minutes over, so I'm going to end here. We can always answer questions later. But when you think mech, don't just think preventive care. Think about, we're trying to design a benefit to meet the employer's budget, and depending on what we offer, we may or may not be able to provide buy-ups. Brian, go ahead. I'll turn it back over to you. And I am not a Texas Rangers fan. I am in Houston. I'm an Astros fan. So I'm Captain America, not Ranger.
I'm surprised Captain America allowed the Astros to lose, but thank you for that. Also, for those of you on this call, we started it really at about 12:04 Eastern. So we're right at 29 minutes. We have no idea why our marketing people chose to have David and I on the first Wednesday webinar that is limited to 30 minutes, because typically when DJ and I watch 60 minutes, it takes us 90 minutes to watch it. So it was a little unfair that we were the first ones to have the 30 minutes, but we would love to hear from all of you. If you have any questions, you can put it in the chat right now, excuse me, or you can email us. There's our contact information, email addresses and phone numbers. I'd be more than happy to talk to any of you, and I know DJ would as well. Again, this presentation has been recorded. It will be available on 90 Degree website, the 90 Degree Benefits website, within 7 to 10 days. But again, if you need information for one-ones, we'd love to chat with you before it's available 7 to 10 days from now. We do have other information on monthly deductible plans and these mech plans. But again, we really appreciate your time. And if you loved this, I might dress up in a different costume. I think DJ and I will be assigned to the October event again next year. So come back same time, same place next year, and you'll see our pre-Halloween webinar. We really appreciate your time. Any other questions for the chat box? If not, we appreciate it. Thanks for your time today, and have a great day.